Hi, I'm Dr. Jeffrey Annamarino from Bellissimo Plastic Surgery and Medi Spa. Thank you for tuning into our Facebook Live. Tonight, it's going to be a very interesting topic. It's about fad diets and how they affect skin and health and maybe surgical healing. And tonight, my guest is going to be Leslie Bonsi. She is nationally known. She's an adjunct professor over at University of Pittsburgh. She's a presenter, a writer. So she has worked with many professional sports teams and right now is working with the Kansas City Chiefs, and they seem to be on top of the world. So I'm sure nutrition has a lot of that to do with their success. So Leslie, welcome and thank you for joining me.
I am thrilled to be here, and let's just dive right into all the things that are out there swirling on the internet. TikTok, which usually makes me ticked off, and all those types of things.
Yeah, it's funny because I think this pandemic has really brought out even more stuff on social media and the internet. And we have to, I always have to warn patients, there's a lot of misinformation. No one's policing this. No one's correcting it if it's wrong. And as you know, people can just put out their information as an opinion, and a lot of people will follow that like it's chapter and verse out of the Bible. So let's just talk about, these trends here in America. First off, I wanted to ask you, is America the only country that gets into all of these diets? I mean, we have so many of them every year. Is it just mostly here or is it everywhere?
No, it is everywhere. I think we see it more here in the US than in other countries, but having traveled a lot in Southeast Asia, yes, there are people there that do keto, or they're doing some version of paleo, or even intermittent fasting. So it is not just a US phenomenon, but the amount of diets that we have, and we have a lot of professional dieters in this country. Like, oh, try this. Oh, I tried this. I can tell you more than you can tell me, which in some cases I believe is true with what it is that people have done. And I think there's always good. I always try and be the Pollyanna here, is there's good in everything that people do because it teaches them something that maybe they weren't doing before. Still the issue is sustainability, maintainability. Right. Can you be on it longer than 24 hours without feeling like you just haven't?
Right. Right. Well, because a lot of patients will come in and they've either talked to another plastic surgeon or they come in and say, how much weight do I need to lose? Or another surgeon told me I had to lose 50 pounds. And, I don't like to evaluate people when they've gone through these like rapid weight losses because, again, sustainability, there's no sense going through surgery if you've lost 40 pounds, but you're not going to maintain the 40-pound weight loss. So I try to tell them it's mostly, and this is something you've taught me actually, is about, not just the sustainability, but, you got to change your lifestyle. It's got to be part of your lifestyle. And then that's where the maintenance comes in. But some of these diets are, they're good for the short time, but how do you transition in and out of those things?
Well, and I think one of the bigger challenges too is that people get caught up on a number or a clothing size or whatever it is of where they want to be that may or may not be appropriate for their body frame size. But in addition to that, when people do the more drastic is, what are you losing? I mean, it's not just 50 pounds of fat. No, it may be 10 pounds of fat and 20 pounds of water. And unfortunately, the rest of that being muscle. Well, that is a risk or any kind of a great surgical outcome. If you've already lost lean mass, we don't want to do that. So I really, help people and really talk to people about body composition is the goal, and fat loss is not rapid. I know people hate to hear that, but that is the reality. It just does not drastically leave the building. It doesn't work that way. And at the same time, we don't want unintended consequences. We don't. So oftentimes when people are taking entire groups of foods or nutrients out of their diet, then the problem with that is how it affects the microbiome, not what your abs look like on the outside, on the inside. What is happening in that lower gut area that may or may not increase the risk of other diseases or impede your ability to be successful with weight loss.
Right. And I know you teach, there's just a balance of everything that you eat, and it's mostly portion size. And I think that's the biggest problem for all of us. It's, because they'll have, where you have to eat, you can eat so many eggs and bacon, as long as you load up on that, it's no consequence, which is just, it just doesn't make sense to me.
Well, the problem with that is, and I think people like this, if whether it's, oh, I can't eat any of this, but I can eat a lot of that. Or if I
Right.
do intermittent fasting, as long as I don't eat after 2 o'clock in the afternoon, I can have whatever it is I want. But then you're not learning anything new, and you're not training your gut to maybe accommodate a different volume of food, because it's just eat whatever in large quantities. So what is that right size portion? Everybody's going to have a different right size portion. But I think part of that is thinking about, we do a little inventory of what is in our closet. Oh, look, it's a platter or it's a plate. Which one do we have? And maybe I want to use the plate more than the platter. It's ridiculous right now. And I do a lot of food demos and try and go and buy something normal in size. It is virtually impossible, except in the kitty department in, a little dollhouse, something. It's nuts, absolutely nuts.
Well, so give me some advice that when, like I said before, patients will come in and say, I get the question all the time, what's my ideal body weight? And I said, I'm not sure anybody really knows that, because it's different from everybody. It's really, what I want to see a patient is, where are they right now in their normal activities, normal routine of exercise, if there's any, and their normal eating habits. Then I can evaluate, do we need to do this, or do we need to do this surgery or that surgery? So there's a way to evaluate. But so when somebody comes to you and says, I need to lose weight, how do you just sort of get them started on what that number would look like?
Well, first of all, I always ask the question is, why is it
Mhm.
that you are interested in losing weight? Sometimes it's for a health reason, sometimes it's for a vanity reason. It doesn't matter, whatever it is. And people want to do it for performance reasons or rehab from an injury. But then I'm going to meeting people where they are. What are you doing currently? How do you eat currently? How many times do you eat? When do you eat the most during the day? Give me an example of what a day looks like, a weekday and a weekend, because for most of us, it's going to be different. Do you eat like I drive by eating as quickly as you can, shoveling, or do you take your time to savor your food? Those are eating habits, and they are critically important. And, again, it's kind of emphasizing this. What do we need to preserve? For all of us, we have to preserve our lean mass, and that is muscle, ligament, tendons, joints, and we've got to take care of our bones. We've got to do that. So thinking about always emphasizing more the what you are going to eat than focus on the what not. Because once people hear the no, you've lost them. Oh, everything I
Okay.
like on that list, right? They're done. They're done. So focusing that way. And then I'm a very big believer in swap for. So I don't want anybody to say, never again can I have pasta. That's why. Never again could I eat bread or have ice cream or whatever. But it's like, if you think about your plate and meal, and you're going to allot maybe a third or a quarter of the plate for a carbohydrate, what is that going to be? Is that going to be a glass of Brunello? Is that going to be a baked potato? I mean, everybody's going to pick
Right.
things a little differently, and then you're not giving anything up. And consistency, thinking about how we eat over the day. And that's especially important for protein intake. So not little eat a steer. So that for most people is going to be more in the morning than they're used to, having a very decent lunch. Maybe it's appetizer before dinner and then dinner, so that we're not necessarily feeling like we have to forage when we're doing the dishes.
Is there any truth to the fact that you can't eat at 9 or 10 o'clock at night?
I've had the fortune over my career to present in a lot of different countries, and remember very distinctly being in Sao Paulo, and at 11 o'clock, you're going out to eat dinner. Unfortunately, I was giving a lecture the next morning. I said, how do these people do this? But nonetheless, no, I mean, the body does not know what time it is. There is not a little alarm in there saying, sorry, we cannot process food after the hour of 10. It doesn't happen.
So even if you're going to eat and say you're going to bed at 11 and you eat at 10, I mean,
Yeah,
at
the
my age, I
worst
get
that happens,
heartburn.
yeah, the worst that happens, right, is you probably, your stomach is wide awake saying, what were you thinking when you're trying to sleep? So in general, when we look from a comfort standpoint, is probably trying to allow 60 to 90 minutes before you go to sleep. But if somebody goes to sleep at midnight and they're eating dinner at 6, chances are they might want to have a little snack in the evening. Now, for people with reflux, different. They probably want to allow 3 or 4 hours so that that stomach is totally empty. But other than that, it really is okay. And actually, especially when we're looking at maintaining and preserving that lean mass, I really like the idea of a nightcap that may not necessarily be bourbon, but it might be a small glass of milk, something with a little protein in it. So we shorten that time from when it is that we had dinner to when it is we're going to eat the next morning.
Okay. Yeah, that's good to hear. Oreos don't fit into that mix though, I don't
Yeah,
think,
well,
unless you have it with milk.
I'm telling you, it's maybe the high protein Oreos, but they're not out on the marketplace yet.
So the other question I get asked a lot is because I have patients that always want to know, is there something they can eat before surgery? What's the special diet? Does anything help them heal faster? And so for the most part, my patients are pretty healthy. I think they eat a pretty balanced diet. So I was always taught that our gut is so important that and we're made to take things orally, digest them. And so if you're getting your nutrients through your food is better. And so this is sort of a two-part question. Number one, what would they focus on? And again, I'm not talking about a quick surgery, maybe an hour and a half long, but maybe 3-4 hours with a lot of work. What should they kind of focus on pre and post surgery? And secondly, do vitamins and supplements in pill form work as efficiently as the vitamins and supplements that are involved in the food we eat? Is it better to choose foods that are higher in those supplements that we may need to recover from an injury or from surgery, or or is it okay to take a pill?
So when we think about what is really important from surgical outcomes perspective, and some of the research that has looked at this, and it's not new, it's research that was done a while ago, is making sure that our protein nutriture is where it needs to be. That's absolutely number one. So for instance, you may have patients that are vegan. Fine. If you're going to be plant-based, it's fine, but you can't take the protein out of the mix. You have to have enough of it. So if you're just eating salad, that could be problematic. So we've got to make sure we're doing soy, we're doing enough legumes, we're having nuts, we're having things that have enough protein in it over the course of the day. In general, and this is the reason why this recommendation of protein is part of every meal. How much? Usually it's 20 to 30 grams, so about the size of a smartphone, right? That's not an enormous amount, but not everybody does that at breakfast. They may do that at dinner, but they're not always doing it throughout the day, especially if people have been dieting in advance of surgery. They may have minimized their portion somewhat. Vitamin C, critically important for wound healing. Now, can the body use vitamin C in a pill form the same as it would from a food? It can. However, foods that contain vitamin C also have fluid in them. Foods that contain vitamin C have the phytonutrients or plant nutrients that have a role to play in terms of being anti-inflammatory. Well, that's an important part of the healing process as well. So if my preference would be, should it be a vitamin C tablet or eat an orange, I would say eat the orange. Definitely makes sense to eat foods that are high. Zinc is another one that is critically important for wound healing, and foods that tend to be concentrated in zinc. One is grains. Well, people who've done these low carb diets, they're not eating grains, so they may not be getting enough zinc. Not everybody eats oysters every single day. So depending upon what somebody's pre-existing eating is, a multivitamin, not necessarily individual supplement unless somebody's had blood work done that indicates they have a deficiency. Those are probably the big ones. As I mentioned about in a food form, the phytonutrients or plant nutrients that are so pervasive and prevalent in fruits and vegetables really is part of nature's ammunition. That's what it is. And that's critically important. We talk about that color on the plate, not just because it's gorgeous, but because it's the fill-up factor. You can eat that without a tremendous amount of calories, and you're putting something into your body that can be incredibly helpful for you.
Okay. Because, when I was doing a lot of burn surgery, we would replace some of these things, especially like you talked about. Vitamin C is a coenzyme, is very important for healing and inflammation. Same thing with zinc, but we were always taught that unless you were deficient in those, adding more to your diet probably isn't going to help you. But some of these patients are undergoing some bigger surgeries. So the only patient population that I actually go over some diet is actually my gastric bypass patients. All the other weight loss patients and vertical gastric banding and things like that, I don't really worry about it as much. But because of the rerouting and the shortened small intestine, I make sure that those patients are getting protein supplements. So I usually have them do protein drinks, but there's other surgery. There's other surgery I do that may be, not to the same extent. So for gastric bypass patients, I have them taking in at least 60 grams of protein more a day than they normally are for about a month after surgery. But maybe there are other surgeries that I do that are maybe not as extensive as that, but would benefit from maybe even 20 or 25 grams of protein. It's the building block.
Yeah, well, and if two things is number one, if somebody's going to be reducing their intake post-surgery, which they are, again, we're trying to preserve that lean. There's going to be some loss of lean mass. It's impossible for there not
Right.
to be, but trying to cut those losses is really what we want to do. So protein has a dual role of helping to prevent some of that extra loss so that, we're not losing so much. And secondly, protein is part of satiety. It is what makes us feel fuller for longer. So that's a dual advantage. And we have so many options right now. So when people need to modify their eating for whatever reason, can they do something that's a protein powder at a relatively low calorie cost? Unflavored ones are great because they can go into anything. Put an unflavored
Right.
protein into gazpacho, bingo, there it is. You're getting the vegetables and you're getting the protein simultaneously.
Right. And so you can use, like you were talking about before, the fruits, and you can mix the strawberries and things that would have high vitamin C and some of the other nutrients that you would need. So the other thing that obviously we do a lot of in plastic surgery is a lot of skincare, and we're all sort of subject to, as we get older, the skin thins, it's hormonal changes, aging changes, all this stuff. Are there supplements or vitamins or things that we need to be aware of? And men are a little different than women because women are a little bit more fragile in that sense. But are there vitamins that you would recommend to help with skin care and not really skin care, but skin health?
I think a couple of things, even looking first before we look at the vitamin, is looking at what somebody's overall eating is like. Are we drinking enough fluid? I mean, I'm dealing with this with my mother right now, who's a terrible drinker. But it's just, a lot of people don't do that. They don't drink enough liquid during the day. And that's critically important for the health of the skin. You have to drink enough fluid. You don't have to have calories in your fluid, but you have to drink enough of it. And I know I sound like a broken record talking about protein as a part of skin cells too. So yeah, you have to have enough of that. That is critically important. And even enough fat. And I've seen very often in my patients, I'm not a dermatologist, but my patients who have been on minimal fat diets, they just don't look good. They don't. And we need that fat for the lubrication. It is critically important. We need fat because fat carries the fatty acid. Fat also carries the fat soluble vitamins. So it's not an either or. So that doesn't mean that people should just have coconut oil all day long and call it a day. But it does mean, however, that this is important. And then when we look at, I do this talk in Broccoli Make You Beautiful. Okay, so studies that have looked at this, it is really the combination of the carotenoids and the polyphenols and all the other things that are in the fruits and vegetables that have that role to play in terms of helping the skin to look good, to look healthy. People look and say, oh, you look great. That's a good compliment to have. And using nature's medicine chest that way. Yes, we could take a supplement. I don't have a problem with anybody taking a multivitamin mineral, but a multivitamin mineral will not have those phytonutrients in it. It can't,
Right.
because you can't extract them all from the fruits and vegetables and bottle them up.
Okay. Because I mean, obviously vitamins and supplements are $1 billion industry. I mean, there's a pill for everything. And, right now, I think a lot of it, especially here in Western Pennsylvania, and especially with women, is vitamin D. And so, there's a lot of ladies now that are being recommended that start using, vitamin D every single day. And so those are the kind of things that I have to start sort of incorporating into my questionnaire with patients, what are you taking? And again, the only patients that I really look to are my gastric bypass patients because they need to be on protein and iron and vitamin Bs and some of the fat soluble vitamins that they don't get. So I make sure that they're taking it. But I think that there's got to be a little bit more in depth on my part of saying, okay, you know what? Most people are pretty optimized for the surgeries that I'm doing, but can I optimize them more? Can I make them a better healing candidate to get them back on their feet faster? And so that's the question I have. And I think the answer is yes. There's probably little things that patients can do.
Yes, absolutely. And the vitamin D is definitely one. The reality is, and not everybody is deficient, but there are a large number of people in the United States who have low vitamin D levels, and they may be outside to a certain extent in the summertime, but we live in Pittsburgh, Western Pennsylvania is not LA. It is not
Mhm.
Miami. It isn't. And hopefully people are being careful when they're outside. So you have some degree of sun protection. Okay, you're not going to be able to absorb that vitamin D. And right now, where there's values all over the board of what's considered insufficient, what's considered deficient, and actually looking towards what might be the best are numbers from 40 to 60 nanograms per millimole. Those are big numbers of vitamin D, and a lot of people aren't there. You can't do it with food. It's one of those few things that it's virtually impossible to get enough vitamin D. Nobody's eating that many eggs a day. Nobody's drinking that much milk a day to make that happen. So that, I think, is a critically important one. Everybody needs to have their D checked.
Okay, men and women.
Yes.
Because we always talk about it with women because of osteoporosis and bone health. We don't really look at that with men. We don't really consider that. But,
Well,
and
I'll
so,
tell you, having worked with these athletes over the years, and one who was a catcher for Pirates and then went to the Blue Jays, and his vitamin D level was 7. I mean, that is like, we are really, and injuries all the time. So it can manifest in other ways. And yes, indeed, you can have muscle injuries, let alone bone injuries, if your vitamin D is low. A lot of fascinating research about vitamin D and immune system. And I think for all of us, also critically important that we do what we can.
okay, well, when you bring that up, so I got to write that down now. So, the other thing is that over the years, I've become, I guess, really more educated in the role of the intestinal tract and the mucosa on gut health, and also when how that is overall. So, and I think that really stemmed from a lot of the burn surgery I was doing, because those patients obviously were not able to tolerate a lot of food and tube feeding. So what about gut health? What can we be doing as far as, is it supplement or things in our diet that we can do that sort of targets gut health? Because as far as immune system goes, the skin is a big part of that, but the gut is a major component to your immune system.
Absolutely, it is. 70% of our immune system resides in our gut. And people don't think about that because we kind of think that's an up here lung thing. No, it's a down there gut thing. And so when we look at what really nourishes the gut, well, the goal here is to have the good bacteria in our gut, and that is critically important. So how do we do that? Partly we do that by making sure that we have the probiotics, and those are the good bacteria, but they don't just exist by saying, oh, I'll take a probiotic supplement. You have to give the probiotics the food, which is the prebiotics, in order for those probiotics to flourish. That is fiber. It's a very big one. And it is other prebiotics, or what we call fermentable carbohydrates. So things like inulin, not insulin, it's inulin, it's chicory, it's bananas, it's garlic, it's chives, it's onions, it's wheat. All those types of things are prebiotics. So they feed the good bacteria in the gut. There was a fascinating study done. We may have talked about this before. The study was done at this point 10 years ago, where they put people on a gluten-free diet for a month. These people did not have celiac disease. At the end of a month, everybody had increased levels of pathogenic bacteria in their gut, decreased level of beneficial bacteria. That was the only change that was made in the diet. So if we don't have to be cutting things out of our diet, we don't want to do that. And for all the people that are doing low carb, and I get it, I understand, some people do, they're trying to lose weight, this feels better for them. There's a difference between no and low. And no may not be the way to go because of things like this, that you may be unintentionally harming your gut as a result.
Yeah, and so I think that's a big part of things that I think is starting to come out. But we talk about in general surgery and things, the leaky gut syndrome. We talk about all the allergies and that kids are getting now, and a lot of times they're targeting the gut. So and I wanted to bring up probiotics, so thank you for bringing that up. So in probiotics, so so people understand. I mean, your gut is full of bacteria that helps us digest, and there's some good and there's some bad. So depending upon our diet, you can swap one way or the other. And so you can have more bad than good. And that kind of makes us feel either good or not as good. So when you take the probiotic, is that something you have to take for the rest of your life? Or is that something that over time you change the gut flora so that the bacteria are different? Or is that something that's just constant because you're constantly shedding those bacteria?
It's something that you do want to do on a regular basis, but ideally you do that with food. And we look at fermented dairy foods. Those are probiotics. If people can tolerate dairy, it is yogurt and kefir. Those are the two big ones. Also, sauerkraut and pickles, the refrigerated versions of both of those, to a lesser extent, they do have probiotics in them. So that's another option. Kombucha, not so much, though. The bacteria are dead when you're drinking it, so you're not getting the benefit there. It has to be live bacteria. And I know people say, "Ooh, I don't like the idea of that," but that's really what we want to be consuming. And again, it's that combo, the pro and the pre, not either or. Now, there are times, and I'm certainly you might have to prescribe them. Sometimes people have infections and they're on antibiotics, and the antibiotic kills the good ones too. So that might be a time where people have to up their intake of the probiotics because they are trying to reflourish and repopulate those good bacteria that unfortunately have been wiped out by having to take an antibiotic.
Are the probiotics that you buy in the store in capsule form, are those sufficient? And if so, are they all good, or are there some that are, what are you looking for when you're going to buy a probiotic?
Yeah, I mean, you want to look for, how much is in the product, and ideally we're looking at 10 parts per billion. This is a lot. It's a lot that needs to be there. You also kind of think about the convenience factor. Is there are some that are shelf stable. If you buy one that's refrigerated, you better keep it in the fridge because otherwise it's not going to do you any
Right.
good. And there are also probiotics are specific to symptoms. So there are probiotics specifically for diarrhea. There are probiotics for IBS. There are probiotics for for constipation. So pick appropriately. There are probiotics that may have more a role to play in terms of supporting a healthy immune system. So lots of different choices out there, and they are not necessarily one size fits all. The other thing about them is sometimes when people start to take them, they notice, a little bit of gut discomfort initially. It's like, oh, not that there's anything wrong. It's just, it is that way. It's not intolerable. It's just that I don't sugarcoat anything. It's kind of the way it is. If you're going to take something, you may notice that you feel like a little wonky in the gut initially.
Okay. Well, it's good to know all of that. Now, the last thing I want you to touch on is we were talking about just briefly about this intermittent fasting that's sort of the craze right now. And again, sustainability. We were taught as kids, as you talk about eating throughout the day, small portions, keeping up your metabolism, things like that. Now you're talking about not eating for 12 to 18 hours, which, for most of this time when I'm in surgery and things like that, it's going to be a long time in between times that I'm eating. So is that healthy? Is it sustainable? People lose a lot of weight doing it.
Well, yes, people have lost weight doing it, but in studies that have looked at quantifying that weight loss compared to any other type of a lower calorie regime, it seems to be the same. So you're not losing any more weight with intermittent fasting or time restricted eating than you do any other kind of reduced calorie plan. But the other thing to think about is, I think where it tends to work best is for people who tend to upload their calories, eating more later in the evening, maybe large dinner and then eating beyond that. Because if they, all right, I'm going to stop eating after dinner, well, you're going to be decreasing extra calories during the day because you cut out that period of time of eating. So that may be beneficial. What I'm not a big fan of is that people are fasting for long periods of day, including a lot of the day. Let's say somebody says, I won't eat after 2 o'clock in the afternoon, but I work out at 6 p.m. Where's the fuel coming from? I mean,
Right.
that's not really positive because you're actually going to be breaking down instead of maintaining or building, if that is your goal, when you are doing exercise. So you have to be able to time it appropriately. I think people should take a look at their day. Nobody should eat 24 hours over the day. Nobody needs to do that, but nobody needs to be eating every 2 to 3 hours either. I mean, ideally, if you're eating in a way where you have 4 to 5 hours between eating occasions, that's fine. And thinking about that end point of the day, I'm going to stop an hour and a half before bed. Maybe that in and of itself trims it down a little bit for you and puts some parentheses around your eating.
Okay. Well, listen, well, thank you so much. I mean, it's great seeing you again. And so we have to get together because I really would like to, and Ella and I have talked about, really getting together and maybe looking at some of the surgeries that we do, maybe putting together some plan that we can give to patients saying, okay, after surgery, maybe these are some things, these are some foods that you should maybe incorporate for the next week or two and see. So I would really love to get together. So hopefully that is soon. And
We'll do that Soothie shot. I think that would be a good thing. Administer
that's
right after surgery. There we go. Beats are in. We'll bring them on.
I love it. Well, listen, thank you again. And everybody, thank you so much for joining us on the Facebook Live. And if you have any questions, please feel free to call us or check us out at bellismoplasticsurgery.com and follow us on Facebook and all the other social medias that I just can't remember all off the top of my head. So we will see you next time.